rate among the population.
Sorry.
And so, it's definitely, it's an issue in the industry. And, we're such a safety focused industry. And yet, when we kind of looked at the numbers and realized that probably about 5 times more construction workers were dying by suicide than were dying by physical on the job causes that we all spend so much time, effort, energy, money investing in, it just really, kind of shook me to my core and said, if this is a workforce that we say we care so much about and that we're so dependent on, we need to take better care of them from this aspect of mental health as well. And so that's kind of how I got involved, and the rest is history. But the needle is moving in the industry, and so just thankful for opportunities like this to continue the conversation.
Michelle, the stats are really alarming, and I know there's a focus in construction, but can you talk a little bit more in depth on why is it construction more? Is it, you talked about, construction is a heavily male industry. Is it just that, or is there something about the industry itself that is really driving it?
Yeah, there's a lot about the industry. So kind of one of the soapboxes that I can get on is when you talk to anybody in the industry and you ask them, what's your biggest challenge? They say workforce, trying to get enough people to do the work. And so trying to take a step back from that and go, well, why is there such a workforce problem? And part of it is the image of the industry. And when you kind of start lining up some of those image issues with some of these risk factors, it really shows how, the industry really does have some work to do to make it a safer place to be. So part of it is really just the people here doing the work. So men definitely much higher risk for suicide than women. And obviously construction has a very high male population. And then it's just the type of people that they are. So it's the same thing that make the industry great and make me love and admire every single person that's on my crews out doing work every day. They're tough, perseverance, grit, determination, stick to it, all of those great traits that help get the job done and, just make them admirable people, can also be huge risk factors when you enter in a personal crisis, an addiction issue, a mental health concern. All of those things, they don't want to ask for help. They're going to figure it out themselves. They don't want to appear weak. They don't want to let anybody down. They're going to just figure it out at all costs. And so that just really creates this kind of perfect storm for somebody to not seek help, not be open to having a conversation about it, and then can lead to, issues like self-medicating and different substance abuse issues. So it can really kind of spiral out of control. And it has a lot to do with just that population. Again, all amazing, great characteristics until they need to get help. And then you just look at some of the other elements like the chronic pain associated from, years of hard work or potential, workplace injuries that weren't properly treated. Schedules, so, very erratic scheduling, long hours, that kind of, those things aren't really helpful for somebody who's living with a mental illness and don't really provide stability that they may need to be getting the treatment and help that they need to be seeking. Time away from home, so remote work, so away from support structures, possibly in environments that aren't positive, for healthy behaviors. Kind of some cyclical elements of the industry. Right now, obviously, everybody has more work to do than they can, but there are periods of layoffs, which create some financial instability, alcohol and substance abuse. So it's kind of part of the culture, pretty accepting of, drinking being kind of part of a normal after work activity. And like we talked about before, if they're not seeking help for things and you're self-medicating to get through them. The pressure of the industry, there's not a lot of room for screwing up. And if you do, it can be really catastrophic. And when you couple that with, possible management gaps, so leadership gaps in knowing how to positively handle performance issues, corrections that can kind of exacerbate the feelings of letting people down if it's not properly handled. So again, really a broad array, but they're all things that we absolutely can manage better and do better and improve the industry in many ways, kind of by addressing these things from the focus of mental health.
Let me ask a question, Randy. I'll direct this at you. Is there things that you feel, there's obviously, Michelle's done a great job of pointing out the gaps and some of the macro issues, I would say. Are there things that the industry employers are doing that actually make it worse? Or is it they're just not, are there things that they just need to do a better job of because of those macro factors? I guess my question really is, are they making it worse in any way?
Sure, it's a great question. If we could just go back to slide 5, Michelle, and I'll answer your question, Scott, but I just wanted to highlight the fact that, suicide is not simply a construction issue. There's always a risk in identifying high-risk groups and focusing solely on why suicide behavior is so high. Suicide is really a societal issue. It's not just in construction. When we look at the data year over year, there's approximately 50,000 deaths annually in suicide in the US. And I always compare that to, if you think about a ball field like Fenway Park, or where you have 50,000 seats, just think of the capacity of that park being full. And every year that number of people die by suicide, not just in the construction industry. It's over 14 people for every 100,000 and about 132 suicides per day. So very impactful. When we think about not just the actual suicides, but the attempts, the average is over 25 attempts, per suicide. So it's not the first time that individual has actually attempted. So when you think about those numbers and the deaths annually, it kind of gives you the idea of the impact that suicide has is in the US. And for every suicide, the data shows us that there's approximately 100 or 110 people that are affected by that suicide, albeit the person's family, the workforce, et cetera. So you can understand the ripple effect that suicide has on a community, let alone, specifically in the construction industry. So I just wanted to highlight some of that data. It's not specific to construction. There are higher risk groups, but suicide affects everyone. And even though organizations may not have had a suicide, it doesn't mean that suicide is not an issue for them.
Yeah, that's a great point.
And expanding the topic out even farther from suicide, I think there's something like 45 or 50 million Americans diagnosed with some form of a mental illness right now. So, there's definitely someone in your organization who is dealing with this on some level or another. And I think it helps to know those numbers, right? Because it can feel like it's a lonely, that you're alone in it, but it's incredibly common in our well, you're in Canada, but so I don't know your numbers, but I know in America it's prevalent. It's very, very common. Go ahead.
It is on, you're absolutely right. And it is no different in Canada than it is in the US when we look at the numbers. For years, we've been reporting that 1 in 4 people will have a mental health crisis throughout their lifetime. And that number hasn't changed in a long time. And that is a global statistic. So again, you may not have had a significant event in your workplace, but I assure you that there are issues that people are dealing with that need to be addressed that are below the surface that you may not even hear about. So having a focus on mental health is critically important, particularly for high-risk groups. But even if you don't fall within that category, it doesn't mean you're not dealing with mental health issues or that your staff aren't dealing with mental health issues. So Scott, to answer your question, I don't think employers are making things worse. I think there's a risk in not doing anything. So to not recognize mental health as an issue is a problem. And not recognize suicide as an issue in construction is an even bigger problem. So there are some great things that employers are doing to address mental health, but the foundation of it for me is recognize that it's an issue so that your employees and your staff feel safe to be able to talk about mental health, that it is an issue, that it's recognized by the organization, and that you're actually providing supports for your employees, be it confidential or not, to help them deal with some of these issues and mental health issues that they could be dealing with, because there are a lot of them. Anything from financial to stress, depression. Doesn't have to be, a clinical diagnosis for someone to need help, right? So employee assistance programs are often helpful, but that's just kind of the tip of the iceberg. What I talk to organizations about is look at what's driving your cost when it comes to absenteeism, when it comes to drug cost, right? You have all that data available to you through your insurance company, through your benefits provider. Look at the data. What's driving your cost? And then start building wellness or mental health programs around that in a very thoughtful way. To simply check a box to have an EAP is not good enough. And also, and Michelle will tell you, when we talk about the construction industry, there is so much focus on physical health and training. Organizations need to see mental health just as important. And if you actually take the same steps you take to address your physical health issue or physical health for your employees and the trainings that you provide, start thinking that in terms of mental health. There are a lot of organizations out there that are able to help. You don't have to be an expert in it. There is expertise out there, so don't be afraid to reach out. You have, health and safety committees. You have HR support resources that can reach out to find that help. So don't be afraid to ask. But the first step is to actually admit that it is an issue and recognize it, and then looking at your data, what's driving it. And come up with some objectives in terms of, so what do we want to do? What do we want to achieve? How can we best support our employees to keep them safe and productive at work?
Well, and when we talk about safety, I mean, behavior-based safety programs, if somebody's dealing with either a mental illness or just a personal crisis, they had, a fight with their spouse last night and they don't know the next time they're going to see their kids, or they're dealing with a financial issue, their mind is not going to be on the task at hand. And so that's, you talk about safety incidents, that's when they happen, is when, the focus isn't there. And, I was talking to somebody the other day on a podcast about this. And like he said, if you have a equipment operator that's going to be out there, moving, equipment, overhead loads over people, if they walk up and tell somebody that they're physically sick, or that they, had a rough night the night before or something like that due to some like kind of physical thing, they're not going to put them on that, excavator and put them in that high risk situation. We need to create the environment where people feel safe to say, I'm not in a mentally safe space today to do this, to, keep people physically safe as well. So it's all so interrelated and connected. And you really can't talk about safety anymore in a true, comprehensive, caring way without including the element of mental health along with it.
Right. Oh. And it's a delicate balance. I think you have to be able to provide the tools, but you also can't force people into them to come, and so you can create all the tools, you can create the atmosphere. My personal belief is that if you create the atmosphere as a leader or as an employer, you also have to step into it and lead the way into the meeting too. I think it starts at the top. And I think even if you just abdicate the authority to have the meeting, but the very top of the leadership doesn't step in and be vulnerable to share a story, how can anyone else feel comfortable to do that? Because the truth is, not everyone may have had suicidal thoughts, but everyone's had a bad day. And everyone's had a really uncomfortable moment where maybe you didn't think about committing suicide, but half of those thoughts that you just had would have triggered someone else too. And so it's the awareness of that, I think, is personally more important than even just the awareness of mental health. I think people need to realize there's parameters of everybody has the same thoughts. It's just everybody reacts a little differently to them. I don't think there's a lot of people walking around in adulthood that haven't had some bad issues that made them feel pretty shitty. It's just what you go about doing about it is the key. So do you guys
Scott,
focus on that for leadership?
Yeah, Scott, you're absolutely right. Or I haven't met an organization that's really being effective in managing mental health without executive leadership championing that cause.
Mhm.
And often that's where it starts. And that's where it should start, to be the leader, to be vulnerable and show that vulnerability, to make it okay to talk about the power that leadership has in supporting these initiatives is super critical. And often that's where I tell, talk to organizations and consult with them on where you need to start. You need to show it, start it at head office. We have large organizations that are decentralized. They often struggle with, well, how do we do this, right? How do we ensure that everyone is getting the same types of supports across the board? And I often, talk about starting small and start at head office, right? Show the way, test it out, and then be able to communicate all the time and cascade, that out to people in the regions, so that support is available, and they know that, geez, if I actually ask for help, it's not going to cost me my job, and it actually feels good that someone within the organization, particularly leadership, cares about me and my family.
Yeah, I think that's because it's everyone. The other thing is you can't make someone talk. They're going to find out they're going to come on their own timeline. But knowing the atmosphere, if you remove the barriers to the atmosphere of finally speaking or finally stepping out of uncomfortableness, you're more likely to have someone raise their hand and say, hey, I need help. Or if everyone else knows that at any given time, the whole company is going to err on the side of, hey, are you okay? Like they're all going to err on the, hey, it's okay to be asked okay, and it's okay to look back and say no. Like if that was just the two things that I think everyone did, like create the atmosphere, leader steps into it. And by the way, this whole company is going to have a philosophy of, are you okay? And then the answer can be, no, I'm not. Mm-hmm. Like if that was it, you probably find a lot more people more comfortable to speak about it. Because I think the lack of community and family and the being alone is what is a big trigger for this. And if you can do the contrary to that, which is create and fill a group of people that can go find that, people are going to go find their group, and if you don't create one to walk into, they're going to go find the one that's going to actually pour gas on the problem.
Absolutely.
That leads me to my next question, which is related to like social media and the factors of social media out there, kind of leading what I was just talking about. I feel as though everyone can go find their group now, and good and bad. And so if you're having bad thoughts and you start to live in a social media driven world, you're going to find a group that might help you, but you're more likely going to find a group that won't. That's my personal feeling, but do you guys find that as well in the social media world and how that plays into this?
Michelle, do you want to go?
I just want to spin off quickly on what you were just talking about before, because I think it's those creating those safe spaces for people and hoping that then that's what they're going to versus the unsafe spaces like on social media. So, my personal kind of mission statement, how I sum up my work in this, is compelling contractors to create caring cultures. So creating those cultures where people do feel safe to ask either for help for themselves or for others. And so, as Randy and I were talking and prepping for this, I shared with them, it might not be that everybody on the team is willing to have that conversation with somebody, but if they know to watch out for things and then who to talk to. So here in our company, people will come talk to me and say, hey, I'm really worried about so-and-so. This is what's going on with them. And so then I can kind of approach them and watch out for them. But creating those cultures where people are watching out for each other is such a big, important component of it, because the person themselves, you're right, might not be willing to speak up or ask for help. But if they know that other people are watching out for them, that creates that safe space that's so important. And then, as far as the social media, I guess the pluses of it are, it's a way to share positive information if they, if you can get it to people and resources and help and things like that. So to help them know they're not alone, there's nothing, wrong with them for needing help, for accessing care, kind of pointing them to directions. But so I guess as an employer, how you encourage that is sharing out those resources, and hopefully people are going to be kind of following and engaging with those so that it's another avenue for help if and when they need it.
So all three, oh, sorry, Randy, go ahead.
I was just gonna say, I totally agree, Michelle, and there's always a risk with social media, because you're gonna find the good and the bad. My own personal experience going through a critical illness is I've used social media for the good and kind of purge the bad because it can be there. I think for organizations, and that makes it even more critical to provide safe spaces for your employees, whether that be a training program, whether that be mental health support, whatever that is, but ensuring that the employees know how to access those resources, where to access, when to access them. That makes it super important, because you can have the greatest resources available to staff, but if they can access it or they struggle with it, because often it is confidential, then they're less apt to use those resources that you invested in and that you have confidence in, and start finding other ways, to Scott's point, to get the support that they need. And sometimes it's not what they need. So it's not just having programs, mental health support available. It's ensuring that your people are aware on how to access it and what it can do for them. The other thing we talk about just quickly in suicide prevention and at Living Works is building, not just suicide prevention support within the organization, but the critical piece in building it in their communities, right? Because that construction worker leaves work every day, goes home to an environment, has a family, has stresses, anxieties, right? And often people, when they do kill themselves, it is at home. So we talk about building communities of safety, not just having suicide awareness and support within the organization, but at home with their families, or where they may go pray, right? And having it where that individual may also participate or engage in sports or activities, that kind of thing. There's less opportunity for them to go elsewhere to try and find support when it's just surrounding them. So we kind of talk about a public health approach to suicide prevention. That's really what we encourage, is not just focusing them, that individual at work, but ensuring that there's support and that there's awareness wherever they work, live, play, eat, within their communities. Sorry, Autumn, I cut you off.
No worries. That was an important point, and it leads into my question, actually, because all three of you have talked about creating safe spaces and communities of caring and communities of safety. And I'm thinking of all the construction business owners I've known throughout my life, and it sounds like a very tall order for some of them. Like, I can just see some of them saying, I'm not equipped to do this. Like, I also am the big tough guy and stoic, and I also don't. So what can a construction business owner do to start creating that work culture?
Yeah, great question. And I'll refer back to a comment I made around just recognizing that it is an issue, that mental health is an issue within the organization. And that kind of starts everything. Ensuring that there's supports, we talk about upstream, midstream, and downstream, right? And that's really what we encourage, is ensuring that there's support wherever that individual is, right? It could be at the beginning of an issue where, we're able to kind of capture it early and provide that upstream support, or maybe they're down, they're at that suicidal ideation level, and, we need to provide some downstream support as well. So ensuring that you have each level covered, I think, is important. And reach out. There's a lot of organizations, and Michelle, we'll talk about CIASP and the work we do on the board, and Living Works as well as an organization that can support. Come and talk to us, right? Be open to getting help. Like we tell people, be open to getting help. We have to say that to organizations and leaders, is be open to the help as well. We know you're not experts in this field, but there are experts out there who can help consult with you and help build a plan, a mental health plan, whether it be that or suicide prevention plan that's tied to it, to ensure that you're supporting your employees and their families at each level, whether it's upstream, midstream, or down. And Michelle, you talk much better to this slide than I do, so please.
Well, I think the first thing is just recognizing you don't have to be the expert. You don't have to know about this, and you don't have to be the person who ultimately helps the person through their issues. You have to have the resources available and know how to connect people to that. But it's really being that connector to care, not necessarily becoming the caregiver. And I think that's a really important distinction, because there's a lot of concern among employers of, well, I don't want to get that kind of entrenched in people's personal things. And plus, I'm just not equipped to help them through all of these issues. And so it's really recognizing you don't have to be the one that's actually doing the fixing. You have to know you have to have the resources available and be willing to connect them to those resources, is the important part, along with being, caring and following up and all of those things. But you don't have to be the actual, doer of the plan. And then it's starting that conversation. So again, we've talked about that bold leadership support, that vocal leadership support for things. And then, making this be something that people start getting a little bit comfortable talking about. So I'm not going to say become totally comfortable, because it's not a totally comfortable topic for many people to talk about, and especially not in a construction company, in the workplace with your coworkers, things like that. So start the conversation. So include it in company meetings. If you have a newsletter that covers wellness things, including information on mental wellness as part of that. Having, in your resources, making sure that information on, suicide prevention lifeline, crisis support, those types of things are included in the conversation. Hanging up posters. So we'll hopefully at the end go out to the CISP website and I can show you kind of some of the things that are there. But we have posters that you can hang up on your job site, poster boards, just right along with your, OSHA postings and all of that. Toolbox talk so that you can talk about it in, as a safety topic. So the one thing that construction's got going for it, and why I think we've made the strides that we have in the short period of time versus some other industries that have tried to kind of adopt this at an industry-wide level, is that we are so safety focused. And this really fits right in with that safety culture if you will be willing to build it in. And so, having it be a part of your toolbox talks. Our THA, our morning task hazard analysis, JHA, we added on that, are you mentally ready to work today? So breeding in that conversation of, it's more than just, are you physically able, or do you have a sore back and you shouldn't be lifting today things, but are you mentally ready and able to be able to work and perform today? And so, it's starting that, and it's getting people comfortable with it. And I can tell you, it's not easy when you start, because the first, safety meeting that you're at and you say, we're going to talk about suicide, and you get, a room full of blank stares kind of staring at you like you have two heads, and why on earth are you talking to me about this? But over the years, it starts getting easier, and people don't look at you like you're crazy anymore, and they start being willing to talk and share and things like that. And then just building it into other business practices that are normal. So, a great opportunity is during group health enrollment time. So, our company open enrollment was in May, our plan renews June 1st. And so typically the open enrollment meeting, you go over benefits and you talk about, go to the urgent care instead of the ER because your copay is going to be lower. And if you go to this doctor, it's this and that. Talk about behavioral health benefits. Talk about, if you need to seek behavioral health, this is the directory. This is how to access it. It's the same copay as, your primary care physician, whatever it is, talk about it as part of the benefits, as part of that overall wellness thing, that your mental wellness is a part of your overall wellness, and try to stop separating that physical and mental wellness component, but really just build it into, we care about all of you. And that includes, from head to toe, not just kind of neck down.
Do you guys share, I would call it success stories, but stories of people who have been in a great environment, one that we're all would like to create, that can say, oh, because of this, these are things that happen, but because of this environment, I was able to recognize that I felt comfortable to raise my hand and I avoided suicide because of X, Y, and Z. Is there a place to share those stories, and are they being shared now?
Well, we would love to have those stories. They aren't readily shared just because it is still a pretty sensitive personal topic that people are just kind of getting to the place where they're willing to share. I personally have some, and I would love to share one here. And but a young man worked for us kind of off and on for a couple of years. And one day his manager called me again, after me talking about this for several years and doing training on warning signs and things. And I was actually at home for the day, but he called me and said, something's wrong with him. Like I identified, like, he's just not acting right. He's not well. He said, so I called him into my office and I asked him, are you okay? And he just broke down and started crying. And he says, I don't think he's safe to go out to work today. I don't know what to do. And I said, keep him there and I'm on my way. And I came in and I met with the young man and talked to him. And I had to ask him, and it was the first time that I had to, put the Living Works training into practice. And I had to say, are you thinking about killing yourself? And he said, I'm not right now, but I have. And I said, okay, thank you. Thank you for being open. Thank you for sharing that with me. And can I please help you get help? And he said, yes. And so, I contact, he was young and single, but he allowed me to call his mom, and we talked to his mom together and assured, like, she was meeting up with him so that he wouldn't be alone and he would go stay with her, and then, got him connected to help through our behavioral health benefits. And he ended up leaving the company a few months later to go on to another opportunity that he was ultimately working for. But he'll still call every, 4 or 5 months or so and just say, I know I was there at that moment for a reason, because sorry, it's hard to, these things are real. And so that's just one story that just happened in our little company here. And so I have to believe that, dozens of those stories are happening every day. And if we can get people to share them, I think hopefully that's what's going to compel a lot of people to start taking this action in their organizations.
Yeah. Hearing that story, and this is why I love the stories to be told, because everybody can relate to a story more than a piece of paper or a slide presentation. And I think what I've heard specifically from you, Michelle, and your organization that you're operating in, is you have a culture that has been created in the company, not just for mental health, but your overall culture. I bet your overall culture is pretty positive. I bet you people that come to work there feel like they're being poured into versus poured out of. They probably don't feel like they're a conduit to an outcome of success for the business owner only. They probably feel like they're part of a team, and if you are part of a team, people are going to be more comfortable to help their teammate. If you're just a cog in the wheel for the benefit of a few, no one likes that. And so I think that's where it really starts. And if you then put a mental health meeting into that culture, you're probably going to find great success. And so it's no surprise that you do have that story, because it's probably in front of every company every day, or at least in some fashion over the course of a couple of years, if you're there long enough. Even if you have a small company, only a handful of people, the stats are the stats. So you just happen to create an environment where someone could feel the comfortable to raise their hand. And think about those 3 or 4 steps in that story. You created the company, you educated to it. It was another person who had to act, they had to recognize, then create an action to actually call you. You had to listen and act yourself. And that there's a lot of steps there. And that wasn't because you had a mental health meeting and a poster up. It was way before that. And I think that's the thing I'd want anyone listening and paying attention to this, particularly the leaders, to really pay attention to. That's my thought on that.
Yeah, no, 100% right. Yeah, you can't, like you say, this has to be baked in. It can't be bolted on. So you can't be a company where people are scared to bring up issues or talk, or, that they're going to get in trouble. If they're walking on eggshells and suddenly you say, hey, we care about your mental health and we want to watch out for you, they're going to have as much trust and reliance in that as, there's not. And so, it really has to be something that's really baked in, and it's part of a caring culture, is absolutely where it starts.
Yeah.
And when it comes to suicide prevention in particular, there's no there's no ownership specifically of that, right, within an organization. And in fact, the reality is anyone can be a helper. We truly believe that. It's not specifically a manager, or the president or the executive that are responsible for it. When it comes to suicide prevention, the organization really needs to own it and understand that anyone can be a helper. It's the question of what type of helper that person wants to be. Some of them aren't prepared to engage the way Michelle did, right? And have that conversation and be able to work a safety plan with that individual. Some people, it's just too much, it's overwhelming, because we're asking them to have conversations that are not natural, right? We don't often ask someone if they're thinking of killing themselves, let alone, even at home. So it's important to recognize that we all own the issue within the organization, from the laborer right to the president, and it's important to be able to offer. So we talk about support and training for people, because there is an important training component to it. It's not just natural for people to have these conversations and be able to have safe conversations and build a safety plan with that individual. So to make it available to everyone is important, so they all feel like they can be a part of it. We'll talk a little bit maybe later on around a company called Mates in Construction that is specifically suicide prevention in the construction industry. And it's about organizations owning their program. It's not Living Works, it's not, SCC Underground. It's that organization who owns it. And everyone within the organization has a role to play in suicide prevention and supporting their mates. So I just want to mention that it's not just leadership that that should be trained on how to support. It's everyone that owns that, and that kind of helps create that caring culture.
Yeah.
Yeah, I think that's so important, because a lot of times you don't want to go to your leader, even if you have a good caring culture in your company, you might have a hesitation to go directly to your boss and tell them that you're having a mental health crisis, because there's the risk of it having a financial effect on your family, right? Like, I won't be able to work. And
Right.
If I don't work, I don't make money. And if I don't make money, my kids don't eat. So you just bury it, but you tell your friend, right? And so your friend on the job also has to have some tools and support on how to help you through that moment and how to get you into a plan for safety, right? They also need to be empowered so that they can feel like they can handle that moment.
Yeah, absolutely. And they need to know who they can go to, right? So we have to it creates that openness, right? Culture of openness, which is important as well. And that has great ripple effect just in terms of people's mental health, right? They know they are safe in that organization, in that environment. A lot of construction work, they go off site, they work remotely for weeks and weeks, right? Where they don't have immediate access to family or supports. So even more important in those locations that there's support within that site, that they know that they can talk to someone, and it's often not their boss. Yeah, training needs to be, I think, available for everyone.
So let's talk about that. Let's talk about the resources that are available. We have about 15 minutes left, and I want to talk about where people can go to find resources, what the warning signs are people should be looking for, and then open it up for any questions. So I know you guys have a slide of resources, right?
We do.
Yeah.
Pretty sure.
Did we hit the warning signs there? I think we had a slide on that too.
Yeah.
I don't think we've gone through them yet. Whichever one you
Okay.
guys want to take first. I just want to make sure we get to both of those.
Sure. Yeah, and then we can and I think the warning signs are fairly, some of them are fairly obvious, some of them are not, but they're fairly consistent. And there's a list here, and we often ask, what would you look for in someone? But to me, the core is, what you're looking for is a change in behavior with that individual, right? Someone might be moody all the time, so having mood swings is no surprise, right? Because Dave's always like that. but Bob isn't. And all of a sudden, Bob, who used to be really excited, he was always very engaged, is all of a sudden withdrawing from activities. We don't see Bob very much. So there are different signs that you can look for. So someone comes to work disheveled, or they're appearing sad. Clearly, there's something going on there, or they're depressed. We often see an increase in alcohol or drug use with someone who might be dealing with some crisis. But at the end of the day, the core of it to me is it's a change in behavior that you've noticed over time, and that's something that could actually click that there's something going on there.
And that's where it gets back to that element of community and culture, is if you have a workplace where those kind of communities are built, and people have enough of a relationship with each other to notice the changes, that's kind of step one, because it's hard to recognize changes in somebody if you're kind of working with a different crew every day and you don't have any of those established relationships. And then the other element of kind of warning signs is, again, changes in behavior, but really ones that are tied directly to their performance at work. So really, decreased problem solving, self-confidence, productivity, and then an increase in tardiness, absenteeism. So suddenly they're, every Monday they're off, or they're coming in late every day with kind of no reason, no explanations, increase in conflict, increase, we talked before about the safety element, increase in near hits, injuries, incidents. So it's those performance issues. And the really key thing as an employer to recognize is being aware of this and approaching things from the standpoint of, instead of instantly addressing it with corrective action, asking, why is there this change? Why is this employee who was never late is suddenly late 3 days a week? And so instead of addressing it instantly with disciplinary action, asking the question, hey, we've noticed this change. Is there something going on that we can help you with that's creating this? And opening up that conversation and allowing them to share, as opposed to if the first way that you're addressing this is, here's your write-up and your final warning, and if you're late again, you're fired. Probably that person's not going to show up the next day, and now you've lost any capacity to help that person, and probably have exacerbated whatever issue they were dealing with. So really taking that kind of caring about the person approach and trying to find and understand the underlying issues and root causes versus just dealing with the performance from a disciplinary approach.
And we talk about resources, and often I come from the world of EAPs, and most EAPs at their core does offer training, particularly for managers, to be able to have those conversations, to train them on what are the signs and symptoms to look for, what are you looking for, what are the performance issues, and how to have a conversation with an employee that shows that, that you've recognized that there's an issue, that you care about them, and that you're able to lead them to resources, regardless of what it is, because you don't want your managers being the therapist, but you want to ensure that you have the right resources available to that individual to recommend so that they follow up.
Yeah. So that's a great lead into resources. So Randy, would you be okay if I navigated out to the website?
Absolutely.
Okay. Let's see if I can. This is gonna work. Okay. Can you see the website now?
Yes.
Okay, great. So we'll go through a few more other resources after, but this is the Construction Industry Alliance for Suicide Prevention that I mentioned that Randy and I are both a part of the leadership of. And we have a ton of resources on here that are all available at no charge to anybody who wants to access them. So they're here. And so you really don't have to invent anything, create anything. You can come here and take everything and get a really great start. So here under the Get Involved tab is, sorry, Get Informed. They just recently redid the website and I clearly am not as familiar with it. So under here, there's all of these different items. So building awareness, integrating things, the toolbox talks that I mentioned are here available to download, the training. So first of all, I'll just go to the integration tab real quick here. And this just talks a lot about that element that we talked about of how do you really start a program in the workplace. So this needs analysis and an integration checklist. This is a live PDF document that has links in it. So it kind of asks you questions about things you may or may not be doing, and then gives you suggestions to address them if you need to work on those areas, with links to resources kind of on our website, off our website, all over. So that's a really great document. And then there's some videos here. So if, what we've talked about today is kind of spurred some questions and you want to learn a little bit more, or you want some videos to share with your teams, this is a 6-part video series that we put together that kind of breaks down some of the elements, and is good to share. So there's one specifically on warning signs. So that's a great one to kind of pop into a safety meeting or something, kind of really practical. Here's the warning signs and what to, kind of super quick overview of what to do about it. And so those are there. Also the training.
And as a bonus, you actually get Michelle, who actually did those videos, as your presenter. So you can't go wrong.
That's not the selling point, Randy. That's why
It is. It totally is. You're just being
they'll be like,
modest.
click off of that. I'm not going to that. And so on our website also is the link to the Living Works training. So this is the organization that Randy is a part of. And that's who the CISP is partnered with as a training provider. And so we have underwriting available to be able to offer training to part of your team at no cost through this. And so there's just a link here that you click, you fill out the form, and then we can send you licenses. And you can also work directly with Randy if you want to kind of set up a more robust training program. But it's a 60 to 90 minute, it's really closer to 90 minutes if you do it properly. It's called START, but it's totally online based. And so it's a great tool to kind of be able to equip people to have those conversations, to recognize warning signs. Again, they might not, they might go through this and I'm still not comfortable to have that conversation, but they're going to have a lot more awareness and know what to do and how to kind of connect people with help a lot better after that. So it's a really great tool that I would recommend. Definitely leaders, but we had all of our field leaders, so any crew leader, foreman, that type of those frontline managers. This is a great tool for them because ultimately they're the ones that know the employees, have those relationships, can recognize the signs, that kind of thing. So this is, I would definitely recommend that level for them. Another thing that's on here is this screening tool. And it's another great way to, if you have, a wellness program and you're doing biometric screenings and things to encourage people to be physically healthy, this is a great way to kind of weave mental health into that, is encouraging taking a mental health screening. So this is another one of our partners, MindWise, and you click on this link and it just takes you out and it's totally anonymous. But you kind of can go through some different screening tools for mental health. And there's just kind of a broad general one. But what it does is, and why I encourage all of our employees to do it, is even if you're not struggling with something, it's a really great tool to build that awareness and that mental health literacy, to be able to recognize some things, because by the questions that it's asking, you go, oh, I didn't know that was something that could, be an issue for somebody. So it really is a key part of kind of building that literacy. And then the last thing I'll point out real quick here is just to take the pledge. So this is, like I said, everything on the site is free, no cost, totally available. But we want to build kind of momentum and presence in the industry for these efforts. And so we love to have companies sign on to say that they are going to stand up for suicide prevention. And so it's a pledge that's just saying that you're going to address this in your workplace. It doesn't commit you to anything. It doesn't do anything. But STAND, and you've seen it on some of the slides, but STAND stands for safe. So creating those safe environments that we've talked about. Training. So the training element is that important. It's part of our, slogan for our organization. So, you've got to get people trained so that they have the information to be able to approach this. Awareness, making people aware that this is even an issue. Normalizing the topic, so getting people comfortable talking about it, making them know that they can talk about it. They're not alone if they're dealing with these issues. And then decreasing, obviously, with the ultimate goal of decreasing suicide in our industry. So that's on here. It's just, like I said, a quick click, and we would love to have people sign on. It also then gets you onto our mailing lists and things like that to continue to receive information.
And there's something about making a commitment, right? When you say a pledge of loyalty, you're not tied to anything, you're not bound to anything, but the power of making a commitment to doing something will actually incent behavior and likelihood that you'll actually do something about it. So taking the pledge, we think, is important.
That is great. And all these resources are right here on this website. So there's an easy way to get started, an easy way to implement it. And most importantly, just start having the conversations to help create, again, what we talked about, an atmosphere where it's comfortable for someone to talk about it. You're not soliciting, you're just making sure the environment is proper and the people in it are also aware, so that when and if this does happen, someone can help prevent it.
Yeah.
And I'll make sure that all of these resources are in the description in our YouTube replay as well, so that people can access them easily. We only have about 3 minutes left. We have no questions at the moment, which I'm kind of surprised by. So I'll just open up the room. I did want to say one thing when you were talking about telling stories, Scott, and I was thinking to myself about the Do Your Part campaign, the Do Your Part mission, which we started at Mobilization Funding, which was our way of helping to move the needle on some of the challenges in construction, including mental health, and greater transparency and communication between all partners, and a bunch of other issues. But one of the things I was thinking was, I talk very openly on my LinkedIn about my issues with anxiety and my struggle with anxiety and depression. I'm just that kind of person. I'm happy to share my stories in the hopes that it makes someone feel less alone. And I think that one thing that we could do, and I've seen it on LinkedIn, I'm very heartened by the stories I see on LinkedIn. That's one thing we can do. If you are in a space where you can tell your story, tell your story on a platform where multiple people can see it, because it normalizes the conversation.
Yeah.
It removes the stigma when you say, oh, my boss told a story about having depression, or, my coworker shared her story of having, crippling anxiety. Whatever your story is, you're not alone in it. And when you share it, you feel less alone and someone else feels less alone. And you make social media a better place.
Autumn, you're bang on. I'll just chime in here because I too use social media for my journeys. I've been struggling with stage 4 cancer, gone through just a whole bunch of terrible things in the last couple of years with the onset of the pandemic. And I've used social media as a means to share my story. And what it's done is it's engaged a whole ton of people, most of who I didn't know before, in the conversation. And sharing those stories is so critical. And the interesting thing about LinkedIn is, I use it a lot for professionally as well. And when I share a story or an article or something, I may get a couple hundred hits. When I share a personal story about my journey, I've had sometimes over 10,000.
Yeah.
Which just tells you the importance and the impact that sharing real stories and being vulnerable and open to support can have on you. So I'm with you, Autumn, on that. Thank you.
Thank you.
And those views, I'm sure, Randy, are positive. There's people pouring into you,
all the
not
time,
trying to, bash you down.
Absolutely. It's all about resources, support, resiliency, hope, right? I call it my bright lights. And Scott, not one negative response or comment have I seen over the last 2 years since I've been going through this. So
likewise, I can say the same for our experience on LinkedIn and mine personally. I've had an enormous amount of people pour into us, more than anyone try to pour out or hurt or damage or be negative.
Yeah.
And it's not even, I don't even think about it as a negative thing at all, because it very rarely happens, if at all. And actually this couple times I can think of somebody said something negative, there was such an overwhelming response from everyone else, not me, to responding to it, that I never even went and talked about it. I didn't even address it. So it's a good it's a good place to use it. But you know what? Your intent is pure, and that's what's important. When you have good intent and you truly are trying to help, people realize that. They understand it, they can feel it, they can sense it, even on social media. And so I think that's really the most beneficial and been impactful.
Absolutely.
I think what both of you guys are doing
Uh-oh.
Thing is, I just want to say your time and your energy and what you guys have put into it all, and especially coming on and sharing it here with us.
My pleasure.
Yes.
Thank you so much.
Thank you so much for giving us your time today. And thank you everyone for joining us. I will send out a replay link in an email, and I will also post it to Scott's LinkedIn. So if you were joining us on LinkedIn Live, there will be a replay available there. All of our replays are available on our YouTube channel and on our website. And I'll make sure all of the resources that Randy and Michelle talked about are also included in the video description. So thank you everyone so
Please.
much.
Yes, please go on and connect with both Randy and Michelle. They have great resources, not only that they've shared here, but also on their own personal LinkedIn's. And it's just good information. And I hope this helped everybody and hope that everyone gets a chance. And be aware, there's a lot of people out there. Just ask somebody if they're okay. It's all right. If you get a gut feeling to say, are you all right? Just ask. It's okay. No one's going to yell at you for asking if they're okay. I promise.
Absolutely.
Absolutely. Thank you guys. Have a good rest of your day.
Thanks, everyone.
Thank you.
Be well.
Have a
Bye.
great day.
Bye, everybody. Thank you.